I want to introduce three ladies on a mission. They've achieved their first mission. That's bothering me for about the last 2 years to come here today. And it's been a pleasure to be bothered by them. And they've achieved their first mission of being here today. The next mission for Vicki, Eliz, and Hilary is to convince men to notice symptoms and women to nag their partners to seek medical advice on an all too common medical problem. Please welcome Vicki, Eliz, and Hilary, the prostrate ladies from Mawddach. Welcome. Welcome. 3 kisses.
Nice, thank you.
Good morning, conference. I'm Vicki Hawes, and this morning I and my 2 colleagues, who are both ex-nurses, Liz Swain and Hilary Nurse, would like to talk to you about male cancer awareness. Before we start, I would just like to say that the slides and video clips shown are with the permission of the Betsy Cadwallader Hospital Trust and the Institute of Cancer Research. Some Rotarians in District 1180 and a few others will be aware that we have been making this presentation for some time, and our overall aim has been to improve awareness of the symptoms of both prostate and testicular cancer. We want men to become better informed about what they should be looking out for and acting on recognition of possible symptoms by going to their GP. Recent reports have highlighted that we Brits have too much of a stiff upper lip when it comes to putting up with things, but that men are the main culprits, and we need to change this and get men going to their GPs when they have symptoms. This will allow earlier investigation and diagnosis, leading to earlier treatment options and hopefully better prognosis. Now, you may wonder why we are doing this. In our club, over a period of just 15 months, 20% of the men were diagnosed with prostate cancer. 3 of those men were our husbands. This got us thinking about how common prostate cancer is and how poor the awareness of the symptoms of this and of testicular cancer are amongst men. Over 41,000 men are diagnosed with prostate cancer every year in the UK. It is the most common cancer in men over the age of 55. An estimated 1 in 14 men will develop the condition, and an estimated 250,000 men are living with the disease. Prostate cancer now accounts for 1 in 4 of all male tumours diagnosed and has overtaken lung cancer to become the most common cancer in men. Prostate disease is therefore a major issue in men's health. But how many people actually know what a prostate is? In the UK, just under 30 men die every day of prostate cancer. That is a startling figure, and a real shame that it is the disease. If the disease is caught early, it is eminently curable and should enable this figure to substantially reduce. As a woman, I am pleased by the help and screening that goes on for women's cancers, but at present there is nothing similar for men, and that's why it's so important for men to know when to visit their GP for advice. Women are helping themselves by running races, buying pink ribbons, doing all manner of fundraising events. We have smear tests, breast tests, and we are taught how to self-examine and be aware of the symptoms that we should be looking out for and being encouraged to see our GPs. However, on the whole, men are unaware of, or maybe would prefer to ignore the signs that something might be wrong, and don't go to their GP soon enough, or worse, not at all. Women can play a big part in educating men about testicular and prostate cancers. We need to emphasise to husbands and partners just how important their continued good health is to us, their families, and to them. And so the stiff upper lip is all very well in some circumstances, but they're burying their heads in the sand about worrying symptoms is simply not an option. You need to be aware. Now, most of you won't be at all surprised to know that a study has found that men spend about a week of every year being nagged by their wives. Sometimes this is over trivial matters, but when it concerns health, women should play a big role in the health of the men in their lives. If men don't get the message about the awareness, I'm afraid the nagging will have to continue. Now, before I hand you over to Hilary, perhaps you could just look at the images of these men, and I'm sure you can guess what they all have in common. That's right, they've all had prostate cancer. Now, I'll hand you over to Hilary to talk to you about it and about the symptoms we need men to be aware of so to get early advice.
Thanks, Vicki. Hello, I'm Hilary Nurse, and I want to talk to you this morning about being prostate cancer aware. This is because prostate cancer can be present without symptoms in its early stages, and as a result of this, many urology consultants are proposing an annual PSA test from the age of 50 so that personal history can be recorded. Prostate cancer is rarely diagnosed in the under 50s unless picked up early because of a family history. In our travels around 1180, we've heard of several prostate cases in the under 50s. This may be because the symptoms in this age group do not often raise suspicion. Some prostate cancers grow slowly, called the pussycats. But some can be more aggressive, the tigers, and unless these are picked up early, could spread to other parts of the body, particularly to the bones. You may have heard people say that their older relatives have died of prostate cancer after many years, probably the pussycat. But if you have the tiger variety, unless treated early, it will probably be fatal. Worldwide, the number of men diagnosed is poised to reach 1 million per annum. In the UK, incidence has trebled over the last 3 decades, largely due to an ageing population and increased testing, hence more cancers. Prostate cancer now accounts for 1 in 4 of all male cancers. Annual death rates due to prostate cancer is 10,000 per annum, roughly 1 an hour. Cost emotionally to the family is devastating. Research is continuing into better treatments and quicker diagnosis of prostate cancer. Current diagnostic research includes a urine test and a more specific blood test, but the most common indicator we have at present is the prostate-specific antigen, the PSA. The PSA is a simple blood test done with your GP, sent to the laboratory with results sent quickly back to your GP. Your GP will then advise you that all looks normal, or, if the PSA level is raised, will refer you to a urology consultant for further investigation. The first step in the consultant's further investigation will probably be a digital rectal examination, and by doing this, he may in fact put his finger on the problem. It's not there. Following this, a biopsy will probably be done. This involves taking 10 to 12 small samples from the prostate gland for examination under the microscope by the pathology technicians. It is the pathologists who will identify the benign tumours from the malignant and the pussycats from the more aggressive tigers. A British Medical Journal study suggested that a PSA test done at the age of 60 would provide a man's better indication of his prostate cancer risk, after finding that 90% of deaths occurred in those with the highest PSA level at the age of 60. The point is when to have the PSA test. The problem is that the test is indicative and not conclusive. Following the BMJ finding just mentioned, it has become every man's right to have the test done at the age of 60, a PSA at the age of 60. but many urologists now think that this should be reduced to 50. However, because the test is indicative, many GPs would be reluctant to do the test without some evidence of symptoms. That's fair enough. The problem is, men don't know the symptoms and do not report the symptoms. Any delay in reporting symptoms could result in an aggressive cancer not being recognised until too late. So what are the symptoms? Weak or reduced urinary flow, needing to urinate more often, probably at night, a feeling your bladder has not completely emptied, difficulty in starting to urinate, dribbling urine, needing to suddenly rush to the toilet. Other possible signs: new pain in your hips, back or pelvis, heaviness in your chest, problems in getting or keeping an erection, and blood in your urine or semen. Now, a lot of men may think that one or more of these symptoms may just be down to the aging process, but don't be sorry. Do not trust to luck. Get any symptoms checked out. I would now like you to watch a short video which is primarily designed for those just diagnosed with prostate cancer, and this may clarify some of the points I have just made.
The prostate is a small gland about the size of a walnut located just below the bladder, and only men have one. The role of the prostate is to produce a fluid that nourishes and carries the sperm when you ejaculate, which is vital for reproduction. A tube passes through the middle of the prostate, which carries urine and sperm to the penis. This is called the urethra. Cancer and other diseases of the prostate may cause the prostate to swell, and this can put pressure on the urethra and interfere with the flow of urine. Perhaps that was the symptom which brought the disease to your doctor's attention. You may have no symptoms, and your tumour will have been discovered as the result of a blood test. Cancer of the prostate starts when cells develop a genetic defect that causes them to multiply. Eventually, a mass of cancer cells called a tumour is formed. Should the tumour be aggressive, cells can potentially spread to other organs to form secondary cancers. The aggressiveness of a tumour can be assessed by examining cells under a microscope. These cells are obtained from a biopsy sample. The appearance of the cells is used to set what is known as the Gleason score, which ranges from 2 to 10, where 10 represents the most aggressive tumour. The majority of men will present with a Gleason score of 6, 7, or 8. As the score increases above 6, so does the potential for the cancer to spread outside the prostate. Ask your urologist what your Gleason score is. The feel of your prostate, based on a digital rectal examination by your urologist, is also an important factor. Some tumours are so small that they are undetectable by digital examination of the prostate. Others are larger and produce swelling known as a nodule, or as an irregularity of the surface of the gland. On the basis of your examination, your urologists will assign a stage 1 to 4 to your tumour. A lower tumour stage is referred to as a T1, for example, while the presence of a nodule is termed a T2 stage. Ask your urologist what stage you are. Another important part of the assessment is the PSA reading. PSA, or prostate-specific antigen, is a natural component of prostate fluid, which appears in a man's blood, in health and in disease. When a prostate tumour develops, higher than normal levels of PSA leak into the bloodstream, resulting in a higher count. However, not all men with prostate cancer will have a high PSA, which is why a physical examination should be an integral part of any assessment. The introduction of blood tests to measure PSA levels has led to prostate cancer being detected in an increasing proportion of men without urinary symptoms. Perhaps this is the way you were first diagnosed. Your medical team may recommend you to have an MRI scan, which produces detailed pictures of the prostate and its surrounding structures. You may also need a bone scan that can identify whether any bones have been affected by your tumour. The results of these tests, along with your PSA, biopsy details, and physical examination, will guide your medical team when considering the best way forward for you. Because prostate cancer often grows slowly, you may well already have had the disease for a number of years before becoming aware of it. So, waiting a few more weeks or months before you come to a decision is very unlikely to affect the outcome.
I think you'll agree with me that was a very informative video. Remember, 1 in 4 men are diagnosed with prostate cancer at some time. Frightening. Yes, but it needn't be a death sentence for so many if only men recognise the symptoms and do something about it. If the symptoms exist and you are referred to a consultant, take someone with you. Excellent support is given from the consultant downwards. If tests have proved positive, you may listen to what is being said, but will not take it in. However, the hospital medical teams and the support staff will listen to your concerns and allow you to make an informed choice as to treatment. If you have been diagnosed, talk to your wife, partner or children, as emotionally you will need support, as you will see in the next short clip.
I remember coming down fairly quickly and fairly easily to the radiotherapy option. And I think probably, as much as anything else, that related to the fact that my becoming increasingly aware that to be able to maintain some sexual function mattered.
When one's life is sort of under threat, that is not a major consideration.
It's a thing that I can live with. 6 years on, my PSA level is still 0.1. And that is the most important thing to me, that my wife and I can still enjoy life. Sex is not the be-all and end-all. A loving relationship at the end of the day overcomes everything.
But I discussed it very fully with my wife. And she said, well, you know, if you're alive, that's much better than being dead. This is I wouldn't get much sex if you're in a graveyard. Which is much better to be alive even if you don't have any sex.
So can I conclude my section by appealing to you all to be self-aware and to make others aware? Remember though, a PSA test is indicative and not conclusive. Your GP will take other things into consideration, such as a possible prostatitis, which is inflammation of the prostate gland, an enlarged prostate. Bear in mind also that if you've had one of these surgically nibbled in the past, then the symptoms may return. This may be a cancer indication. You may have a kidney infection. You may have a simple urine infection. Or it could be an indication of diabetes. But all these symptoms need reporting and treating. People with prostate cancer say, it will make me impotent. It's a foreign body, I want it out. Cancer invaded my space and I wanted it out. I hated the thought of it growing inside me. Please remember, your wife or partner and your family all travel the prostate road with you. Yes, your prowess may be affected, but not necessarily, and there is always help at hand. Sex life versus life itself, I know which I'd rather my Peter had. Thank you for listening. I'll pass you to Liz Swain.
Hello, I'm Liz Swain. Now, having dealt with the older generation, let's not forget about the younger ones. What do we know about testicular cancer? This is the most common form of cancer in men aged 15 to 45, and it affects 2,000 men a year. Since 1975, the incidence of testicular cancer has more than doubled, and we don't know why. But what we do know is that if caught early, it is 99% curable, and even with a later diagnosis, there is still a 97% chance of a full cure. How is it caught early? By self-examination. This is fantastic because it means it's a hands-on job. Now, don't turn off. Just because the majority of Rotarians seem to belong to the prostate age range, many of you will have sons or relatives on the younger age group to whom this applies. And as good Rotarians, you will be able to deliver this vital awareness message. We are all aware that male reproductive organs are so important. They control the male characteristics, they are used for reproduction, and they are a symbol of masculinity. So, what are the signs and symptoms? A lump in either testicle, any enlargement of the testicle, a feeling of heaviness in the scrotum, a dull ache in the lower abdomen, back, or the groin, a sudden collection of fluid in the scrotum, a growth or tenderness in the upper chest or breast, which is due to a certain type of testicular cancer. Do keep in mind, though, that some testicular injuries, infection or inflammation can cause painful swellings and can cause some of these symptoms. And what are the risk factors? Firstly, it affects men between the ages of 15 and 45, but occurs in older men. A family history of testicular cancer, those with a history of an undescended testicle, those with a history of previous testicular cancer. It is more common in white men rather than the black races. And contrary to past opinion, there is no known link between a vasectomy and testicular cancer. Now for the self-examination, or if you prefer, DIY, do it yourself. It's preferable to do this after a shower or bath when everything is relaxed and soft. Cup each testicle in the palm of your hand. With the thumb and the forefinger, roll each testicle in turn, feeling for unusual lumps, bumps, and swellings. Gently squeeze each testicle and feel for any changes in firmness. Get used to the size and weight. It's important to do this at least once a month. Remember that each testicle has an epididymis, which is a small bump on the upper or middle outer side of the testes. Now, no excuses, guys. It's free, it's easy, and you are in control. And don't forget, so many changes are innocent. But if you have any concerns at all, check it out, go and see your doctor. As a valuable contribution to this DIY examination, Screwfix, the DIY supplier, is a sponsor for the Everyman campaign and uses this catchphrase, "Don't be a spanner, check out your nuts." And every man thinks so too. I'll now hand you over to Vicki to conclude.
In putting this presentation together, we have had the support of urology consultants and GPs from our district, and who all thought that a national RIBI awareness campaign would be a great idea. We have been heartened by the interest shown so far and by the reception we have received from clubs we have visited. We feel that this positive reception is largely due to the fact that we have lived through the cancer journey with our husbands, and we have had the distinct impression that having the facts presented by women whose lives have also been affected has made men take notice of the information presented to them. We have had great backing from our district, and we would like to see some clubs in other districts taking up the challenge of getting the message out, not only in Rotary clubs, but also in other organisations. We know there is interest because following a letter we wrote to the Times, we were contacted by Rotary, Probus and Lions clubs. Making our presentation available on DVD was an idea. This is great news, but usually these presentations are followed by a question and answer session, which we feel needs to be run by a medically trained person who is familiar with the subject and who can be helpful by answering questions raised at the end of any presentation. If your club has such a member or knows of a suitably qualified person who can help, then why not help us spread the word? If you can't do that, then we would urge you to support our campaign on two fronts. Firstly, by supporting the charity that promotes symptom awareness for all male cancers, the Orchid charity, and secondly, the Everyman Appeal, the male cancer-specific fundraising arm of the Institute of Cancer Research, that desperately need funds to find the elusive and reliable diagnostic tests for prostate cancer and to further improve methods of treatment. Incidentally, I'm sure you'll be pleased to know that thanks to early diagnosis and treatment, our husbands are all here watching us do this presentation. So in closing, please support us, talk to people, spread the awareness message by organising events. Don't sit on the problem. Come and talk to us in the House of Friendship if you have any questions, and buy a Rotary Male Cancer Awareness badge. Thank you for listening, and we'll leave you with this thought. Thank you.
Thank you very much. No, it's okay. Thank you. Thank you very much.